Welcome back, everyone, on this Saturday morning. Steve Cashel, Dr. Brian Cole. It is Sports Medicine Weekly. Our website is sportsmedicineweekly.com, and that leads us to this. Time now for our Ask the Doctor segment here on SMW, giving listeners an opportunity to have Dr. Cole address their specific sports injury issues. It's very easy to ask a question. Go to the homepage on our website, sportsmedicineweekly.com. Underneath our picture, you can click on the link and ask the doctor a question. We actually have one guest, one listener, came all the way from Geneva, Illinois, in studio with us this morning, Dr. Cole. Alex.
That is a motivated, curious guy.
To ask you a question, this relates to Koby Bryant and PRP. Alex, good morning.
Yeah, so we hear a lot about athletes that travel overseas for various treatments, and I think Koby Bryant had this Orthokine procedure or injection, and I'm curious to know how that relates to PRP. Is it something that's considered superior to PRP, or what is sort of the mechanism behind that injection as it relates to PRP?
Alex, that's a great question. So Orthokine, some people will call it the Koby Bryant technique because the media got a hold of it, and he flew to Germany to get this. So basically, what is involved is it's a blood draw where a aliquot of blood is split into 5 quantities. It's placed in a glass container with beads in it. It's then it's incubated and then placed in a centrifuge, and it gets something that's very close to PRP. So the challenge, PRP, on the other hand, is a single blood draw done as a point of service in an office setting typically, but sometimes we use it as an adjunct to surgery, where we draw blood, get a concentration of your platelets, and by spinning it down in a centrifuge for 5 minutes, and the platelets have really important growth factors that can reduce inflammation. So we treat everything from tennis elbow, ulnar ligament injuries, osteoarthritis, and things like that as an adjunct to reduce symptoms. So it's really important to know that none of these techniques will regenerate things like new tendon or new muscle or new cartilage. They're all designed to shorten the duration of an individual's symptoms and allowing them to be more active associated with that symptom reduction. So the biggest challenge with Orthokine, in my opinion, is it's somewhat inconvenient. Some of these athletes are spending a week there. It's expensive. It's at least $15,000 to $20,000. And there's, to my knowledge, there's been no proven head-to-head comparisons against PRP, and it works in a very similar way. And there's some other aspects of it in terms of growth factor concentration and so forth that make it really challenging to assume that this is sort of the best, to say it's the best treatment for osteoarthritis. So it was a bit of a craze. I would say that it's died off a bit. I was recently appointed to the MLB Biologics Committee, and that helps to regulate what goes on in the MLB to help provide good, sound, evidence-based decision-making for the players who seek alternative treatments. And I'll tell you that this has not come up, at least recently, to my knowledge, to any of the organizations, at least in the MLB. So great question. There still needs to be more research in this area, but it is of interest.
That's Dr. Brian Cole's Ask the Doctor segment. Thanks so much, Alex, for your question. In follow-up to that, I've got another one that kind of relates the same way, Dr. Cole. Can PRP acid injections do anything for scar tissue within a joint, or is surgical removal of scar tissue the only way to get rid of it?
So if someone indeed has scar tissue, scar tissue is a very generic statement, I've got scar. Scar really only forms in the face of injury. So it can be a traumatic injury or it can be surgery. That's the first thing that people need to know, because I get that asked a lot. People come in and they say, look, well, my knee hurts. Do I have scar tissue? You don't have scar unless something promotes scar formation. So it has to be a big injury, typically with a bleed, or a surgical intervention. If someone has established scar tissue, which is basically disorganized collagen that reduces mobility or the movement of a joint, one should not assume that injecting anything that I know of will reliably release it. And if it doesn't get soft and more mobile over time, or physical therapy doesn't help it, then sometimes surgery is required.
All right, so you can recognize scar tissue when you're looking inside someone's knee, right?
Sure.
But are you saying it's kind of a misconception that there is no such thing?
Well, first of all, scar's not always bad. Most of what we do is heal with scar.
Which is good, yeah.
It's how we stabilize things. You heal and scar. It's called scar and continuity. That's what happens. So scar is not all bad, but scar in the wrong location can be a problem.
All right, so the follow-up to that is, and if scar tissue is removed surgically, does it just come back, or is it gone for good?
Yes. Both can happen.
Okay.
Yeah, they can both happen.
Dr. Cole, great stuff. And again, thanks so much to Alex and also Catherine sent her question about PRP. Again, if you want to be involved with our Ask the Doctor segment, then just go to the homepage of our website, sportsmedicineweekly.com, and click on the link underneath our picture, and you can ask Dr. Cole a question. Up next, Kim and Mike Adamley will join us talking about Mike's CTE diagnosis, and we'll talk all about that and what he's doing to fight that condition. You're listening to Sports Medicine Weekly only on
670 The Score.